I'm Kevin O'Donnell with Canon Medical Systems, and I participate in a number of the QIBA committees in process and a number of the different modality groups. So in the QIBA committees, we understand that you want to apply quantitative biomarkers to making clinical decisions. And that depends on the process that's generating those biomarkers producing consistent values. And so the QIBA profiles identify the details that are most important for that consistency, that repeatability, and then sets constraints and requirements on the devices and staff that they have to meet in order to provide that consistency. The important thing is that the QIBA profile puts the vendors and the site staff on the same page in terms of expectations and who is responsible for what. So the profile checklists include specific performance requirements for the scanners. And those typically involve scanning phantoms and generating performance metrics. So as vendors, we will put together a reference protocol and then perform the conformance checks and then publish a conformance statement including all of those details. Now, sites can choose to use a different protocol, in which case they would go through the same assessment procedures to confirm that the scanner performance with that protocol is up to what the profile requires. The requirements are similar for analysis software, just focusing on the analysis performance of the software. I should note that everything in the checklists are requirements, not recommendations. That to keep things as simple as possible, the committees really work to make sure that if it's not directly needed to achieve the performance that the claim states, that it's not included in the checklist as a requirement. There is a section, discussion sections further down the profile, which include recommendations, and those may further improve your performance, but that's more of an extra credit kind of thing. So the first thing to do is to get a hold of the QIBA profile document. Those are all posted in the profiles section of the QIBA wiki. Inside you'll find the checklists. Some of them are short, some of them are a little longer. And you'll start incorporating that into your site imaging procedures and training your staff to follow those steps. You can reach out to your vendors and find out if they have conformance statements for the equipment you have at your site for that particular profile. Otherwise, you'll go through those same assessment procedures yourself. I should point out that for some profiles, there are services out there that will help you go through the assessment procedures, either for modalities or in some cases with your staff. But the important thing is to start working on those checklists. You do need to complete all of the checklists to be fully conformant with the profile, but honestly, any of these pieces that you incorporate into your process is likely to be improving the quality of your biomarkers from where it is today. So feel free to get started as much as you can.